Just checking in with the panelists if everything is fine. Are you ready to start? Okay, great. So this is silence before the storm. So thank you so much for coming to this session on climate resilient and environmentally sustainable health systems. It's a great pleasure to welcoming you for that very hour. My name is Oliver Schmoll. I'm working at the WHO European Center for Environment and Health, and together with quite a few co-workers, I'm looking after the work on climate change adaptation in that very office. Today we have come together to focus on climate resilient, low carbon and environmental sustainable health systems. And what a coincidence. Today is the day when the UN climate conference closed with a consensus statement being produced, which was highly debated in the past days. And I'm sure some of you have been following these discussions through media. And today, global leaders concluded that they want to transition from fossil fuel in the energy sector. It's not a phase out, but a transition out of fossil fuels. And to double renewable energy while also triple renewable energy while also doubling energy efficiency in all sectors. So this is the conclusion that we learned about this very morning from the UN climate conference. But for the health people, the Sunday before last was a big moment at the conference of the parties. The so-called Health Day took place at the conference of the parties, where more than 50 health ministers came together at a COP. That never happened before. And these health ministers have been adopting a declaration at the conference of the parties, the Health and Climate Declaration. And in this declaration, health ministers have been calling for action to take climate actions for protecting human health, with health being perceived as the human face of climate change. In that declaration, health ministers have been also calling for establishing, quote, transformation of health systems to be climate resilient, low carbon, sustainable, and equitable. And I think this is a quite nice coincidence that we are also discussing here during this conference in how far climate change and environmental sustainability are also contributing to this agenda that is being discussed over these 2 days on trust and transformation in terms of creating resilient and sustainable communities and health systems. The First Lady yesterday spoke about ongoing transformation in all societies in response to the changing climate. We adapt, we change lifestyles in order to reduce our carbon footprints. But at the same time, these transformations will also need to be embraced by health systems and by the health sector at large. And this is why we are here today to discuss a little bit more in detail. The session will run as follows. We will have a keynote introduction by my dear colleague, Dr. Dorota Jarosinska, giving a little bit of a landscape of what is happening currently in the international space in this field. And hereafter, we have a wonderful panel here with us that I'm going to introduce a bit later once we engage in the panel discussion. So I will introduce the panelists one by one a bit later. And then we will also have opportunity to limited time. We only have 60 minutes to discuss for 10 minutes your observations. You may have questions for the panelists, and then move on to a conclusion. And I hope this is acceptable to all of you. And I also would like to mention that we have Nicole Mauer with us. Nicole, you may wave. Nicole has the most important job in the room and basically making sense of the discussion and synthesizing a page that is being brought forward into the general meeting report. So with that, without further ado, I would like to invite Dr. Dorota Jarosinska, who is a fellow co-worker in the European Center for Environment and Health in Bonn, Germany. And Dorota is managing the program in living and working environments, and as such looking after climate change mitigation primarily in our office. Dorota, the floor is yours.
Thank you, Mr. Moderator, ladies and gentlemen. It's really a great pleasure to be here, and we are really happy to have this session. It is timely because of the COP28 conclusions. But it is also timely because climate change is already an issue that is taking toll on human lives, livelihoods, and also putting huge economic pressure across the world. And the projections are that it will go even worse if we don't act efficiently. Just a reminder that we say climate change impacts health. So it's not only the spectacular immediate effects of extreme weather events, but these are also impacts of these creeping, slow onset changes, deteriorating air quality, new pathogens in the water, etc. And while we can all be affected, those who are vulnerable because of their age, health condition, but also their socioeconomic status, they are bearing disproportionately high burden. And when we think about the health impacts, it's communicable and non-communicable diseases. It's acute and chronic conditions. It's our physical and mental health, impacts on young and old. But it's not only the burden of individual human suffering, but it's also a huge pressure on the health systems. And it's really a must, a demand of this transition and of this transformational change where climate and environmental considerations become an integral element of making health systems resilient. So keeping in mind that climate change really cuts across all domains of health, also our response, this climate action for health, needs to be comprehensive. On the one hand, we need to address the risks that are already there, dealing with heat. We need to promote mitigation of climate change, reducing emissions of greenhouse gases, so that we can benefit because of better air quality, because of changes in our diets. But there is a special place for health sector, for health systems action, and that's for a variety of reasons. On one hand, there is this non-negligible element of a moral obligation. We have a duty of care, and I would say that these actions to embrace these climate considerations, this, I believe, for many of us is this element of a passion of care, bringing this into the operations of health systems. But health sector as a branch of national economy is also contributing to climate change. Globally, it's up to 5% of global greenhouse gas emissions that are coming from the health sector operations. There is a huge space for improvement when it comes to the whole supply chains, which account for roughly 70% of the carbon footprint. And again, within the health systems, these actions need to go in different directions to make health systems and individual healthcare facilities resilient, to be able to provide quality of care in case when facing emergencies related to climate change, but also reducing their own carbon emissions and keeping in mind this environmental sustainability, efficient use of resources, a choice of materials, devices, avoiding hazardous chemicals, and also handling medical wastes. These efforts need to be taken at the level of the whole health system, but also at the level of individual healthcare facilities. And there are several building blocks related to the very provision of care, related to the infrastructure, related also, and maybe first of all, to the people, to the heart of the system, which is the healthcare, workers, health professionals. We have heard a lot about it yesterday and today in the morning. So to add one more component of education, capacity building, and empowering us to really take actions at different levels. This is a big task. This is a task that requires many actors, but this is also the area where experiences exist. So we need to pursue these efforts working in partnership, seeking alliances from individual healthcare facility up to the health system and international level. In that context, I would like to mention the commitments formulated by the 53 member states of the European region at the ministerial conference in Budapest. It was already mentioned yesterday in the opening statements. But the issue of making health systems climate resilient, low carbon, environmentally sustainable is an integral part of the declaration, and it is a strong voice of member states to pursue this line of work. And another important element mentioned there is to increase literacy of health workforce, climate literacy, climate and health literacy, so that people are really empowered to act. To facilitate sharing of experiences, mutual learning, and creating a community of practice that will translate these high-level political commitments and ambitions into the practice, a new modality of cooperation has been proposed. It's so-called environment and health partnerships. And one of them is health sector climate action, bringing together countries that are interested and willing to unpack these political commitments and put it into action. This initiative, this partnership is led by Ireland and with a couple of other European countries joining, and the invitation is open, and we hope that this partnership will be growing. And to conclude, a reminder about this global framework. Oliver has already mentioned what has happened today, just a few hours ago. But indeed, speaking about this Health Day, which was for the first time on the agenda of Climate Summit, we were also very happy to have the regional voice with the regional dialogue, bringing together ministers of health from the European region who were discussing exactly how to accelerate action. So it's not about building the evidence, but it is how to act. And this year's Health Day is the result of the initiative starting in 2021, when for the first time health program was adopted, and then building up towards this year. We are very happy about it, though there is a bitter taste that it was COP26 when the first health program was established. Let's hope that we will be moving ahead much faster. So with this, thanks a lot, and looking forward to hearing the panelists. Thank you.
Thank you so much, Dorota, for nicely setting the scene of reminding us on the relationship between the changing climate and the multiple health impacts that come along with that, but also clearly putting on the table that we have established frameworks and mechanisms through which we hope to mobilize momentum also in our region to address these challenges. And the Partnership for Health Sector Climate Action is one of the modalities among others. But most importantly, I couldn't agree more, Dorota. Yes, it is a moral obligation of the health sector to embrace this agenda and to walk the talk and to lead by example on responding to the changing climate. So with that in the back of our mind, I would like to turn to the panel and welcome you all again. Thank you for joining this afternoon, and it is my great pleasure to welcome Professor Breda Smith, who is the Chief Medical Officer of Ireland. Dorota has already been mentioning Ireland's leadership in the area of climate change and health. Ireland is really one of the very inspiring examples to the European community in working in this area. And Ireland has made commitments actually to achieve net zero carbon emissions by 2050 in the health sector, while transforming the health sector into something more resilient and equitable. And Professor Smith, Ireland has underpinned this with a climate action strategy, which is fresh from the press, I should say, this year, and is to guide your actions. Can you give us a little bit some insights on this very strategy, but also a little bit shining some light on the main drivers and incentives for Ireland to actually develop such a strategy, and probably also whom you had to convince to walk that talk? Over to you.
Thanks very much. Thank you. And I'm delighted to be here today to talk to you about this. So in Ireland in 2019 we developed a health sector adaptation plan, and that predated a considerable movement. One of our coalition government parties is the Green Party, which has a green agenda, which has really been promoting and driving this agenda throughout our society, not just our health sector. And also is getting cross-party support for it, because we all appreciate how important this is, and it's a really important topic. So then earlier this year, the government launched their Climate Action Plan, and that actually was following the Climate Action and Low Carbon Act that was passed in 2022. So following the launch of the Government Action Plan, then our health sector in May of this year, the HSE, so that's the Health Service Executive in Ireland, they launched their Climate Action Strategy 2023 to 2050. And this builds on Ireland's whole of government approach really to climate action, but focusing primarily on the health sector. And within this, this puts in place a governance and oversight structure to drive 6 priority areas. Priority area 1 is sustainable buildings and green environment. Area 2 is transport and mobility. Area 3 is sustainable procurement. Area 4 is greener models of healthcare. Area 5 is water and waste management, and Area 6 is adaptation and resilience. So examples of this are, within our transport, that would be, our hospital transport systems to make them greener, and also to avoid unnecessary patient and staff journeys. An example really within the greener models of healthcare would be more virtual healthcare, moving care closer to home, which is consistent with our overall Sláinte Care health policy. So for each of these priority areas then, working groups have been established, and these working groups report quarterly on the achievements of their objectives. So this is a very exciting project that we are committed to and are delivering, and it is, I suppose, driven by its overarching governance then. And this is a whole of government approach, and there is support for this. And it is based really and can only be successful through intersectoral partnership and working with other sectors like the transport sector, like the built environment. So we are also in building our new hospital buildings, promoting a greener agenda within the structures of our health services that we use and the institutions that we use. Another example really of moving this agenda forward within Ireland and is very recent is our One Health partnership. And currently we had a One Health symposium in Ireland, which was attended by 3 ministers: health, agriculture and climate. So we are integrating it into our One Health response, and we will be moving forward with engaging with the climate department, and environment, ensuring that they are part of the governance structure of that One Health partnership. So these are the elements and the way that we're moving this agenda forward in Ireland.
Thank you so much for this. This is really inspiring, seeing the leadership that is basically coming from a whole of government approach, but the health sector being integral part of that, the commitments that you made, and I think your point on that, requires really action across sectors. No one sector is moving on its own in that regard. It's a very strong message, but also equally strong, health is taking the lead also on this, and to look into its own backyard in contributing to the national climate objectives. Thank you so much,
Thank you.
Breda. I would now like to turn from national strategies and policies all the way down into a healthcare facility on the practical side of things. And it's my great pleasure to introduce to you Andra Migo, who is the head of sustainable transformation in the North Estonian Medical Hospital. We had a lot of joy already in preparing for this meeting with Andra. And I would like to ask you, Andra, if you could tell us a little bit more of what practical steps you have been taking in your hospital and towards becoming more climate resilient and sustainable, environmentally sustainable. And also, perhaps you want to share with us a few challenges that you have been facing in this endeavor.
Thank you. It's really a pleasure to be here and to share our experiences. We started our journey by mapping our CO2 footprint. And we got aware that our biggest contributors to greenhouse gases are facilities and energy consumption, the same areas as you mentioned. Also non-medical and medical equipment and pharmaceuticals, and also thirdly, transportation and commuting. So these are the focus areas where we are focusing. Also, we got aware that what are our low-hanging apples, and we got aware that the biggest and the lower apple that we picked up is switching to buying green energy. But today I'm not going to talk about the biggest things, but rather about change, giving you some examples what we have experiencing in terms of making change happen. So we started with the simplest things, like refraining to use disposable dishes to provide meal to patients and employees. That was a success story because we were really expecting a lot of disputes, a lot of disagreements that people are not agreeing to switch to reusable ones. But it went really, really smoothly because people were so used to use reusable ones at homes, so it was easy. At the same time, we decided to refuse using bottled water. So far, we've been using 250,000 bottled water bottles in a year, which means 700 per day. That's a huge amount, it's costly, and it also has an environmental impact. And when we decided to abandon it, then it went also quite smoothly. But this story has another aspect as well. Some of the wards, they decided that instead of now ordering the bottled water, they will start ordering empty bottles from our warehouse, so that they could fill it with the tap water and then pour it to the patients. What is the downside of this action? These bottles are not part of our recycling system, which means that this is the waste that goes to landfill or for burning. So it didn't have the environmental impact that we expected it to be. And as a third example, I would bring out the huge campaign that we made this year, starting from April. We were inviting all our employees to commute to work by bike. Well, it was really nice weather this year. It was easy to do it. And we had a huge campaign, posters everywhere saying that come by bike, it's healthy, it's cost-saving for our own money, it's environmentally friendly, and so on. We improved all the things in technical aspects, so you had secure parking places and repairing things and everything. And there was a prize for the department that could provide the more biking rides to work. But it didn't work. I went and counted all the bikes every morning, and it was still 60 people, 60 out of our 4,000 employees. Why didn't it work? I did my homework afterwards. Estonians are the biggest car lovers in Europe. We do have 608 cars per 1,000 inhabitants. The car is a status, it's a symbol of status. And also the infrastructure is just at the beginning of creating it. So there was no use of me making this campaign, and the failure was kind of built in, because we cannot change from inside out the things that we are not influencing. So if I would wrap up these three examples, then I would say that if we want the change to happen, then we always have to bear in mind that the most important thing is that the change the real change is made by a healthcare worker, healthcare employee in the field. So the choice that he or she makes has to be really easy to make. So we have to make the sustainable choices the most easiest ones.
Thank you so much for sharing these experiences that you have, positive as well as challenging experiences. But it also gives a good idea of that we really need to unpack these big words, make systems resilient and sustainable and etc. But this is where it comes down to at the ground level, actually, to to nudge these changes and to seek buy-in by everyone and pulling the same strings in the same direction. So I think this pair of interventions from the longer term strategy and policy all the way down to concrete action that can happen at the facility level, I think they need to go hand in hand after all. You need both champions on both sides to nudge and to trigger change. Thank you so much for sharing these experiences. Now I would like to invite Gabriella Abruzzo, who is a climate officer with Healthcare Without Harm in Europe. And Healthcare Without Harm, as many of you will know, is one of the forceful players and drivers of the agenda of making health systems sustainable and low carbon. And I would like to ask you, Gabriella, Healthcare Without Harm has been working with many hospitals across the continent and has gathered many experiences in that regard. And I would like to ask you, taking a bird's perspective on that work that you have been doing, what would you say are the enablers to facilitate change, and what needs to be done to integrate climate and environmental considerations also squarely into the health systems agenda, basically to the audience of that conference?
Yes, I think for Healthcare Without Harm, the two preconditions to facilitate the change and to enable the transition to a more sustainable healthcare sector are the network and the raising of awareness. Dorota said two beautiful things that Healthcare Without Harm really loves, is making alliance and climate literacy. For us, our work is all based on networks. We have one network of hospitals that Andra is part of, and it's always beautiful to share the stage with our members, and three networks of healthcare professionals, one doctor, nurses, and a pharmacist. And for us, the first thing to do is to talk about the problem. If we don't know what is the problem, we cannot work on it. And we also think that sometimes in hospitals, healthcare professionals are not always listened when they talk about the impact of the healthcare sector on climate and on the environment. And knowing there are other people in Europe and in the world that are working toward the same direction is an incredible boost, an incredible source of inspiration, and a great opportunity to learn and to share experiences and challenges, because it's not something easy, but it's important to start thinking about it and to start also with small steps to work toward a more sustainable healthcare. And starting from these two preconditions, so to making alliance with other hospitals and with other healthcare workers, it's important then to act from that point of view to the health system level, trying to influence strategic planning of the health system that is more sustainable, and it includes climate as part of the agenda. And climate that is not only reducing the emission of the healthcare sector, but also making the healthcare sector more resilient, because we have seen that not only climate change is affecting the health of people, but also is affecting the healthcare infrastructure. And hospitals in some situations are not able to provide any more their services. And also it's important to have all this awareness and commitment to change and influence legislation. There are many fields that can be influenced, and at Healthcare Without Harm, our Sever Pharma team is doing an amazing job in advocating about AMR. And I will say that a final word. I want to mention two projects at Healthcare Without Harm. One is Operation Zero, where we support national health systems to become more sustainable, and we help them to write a roadmap to reduce their emissions. And one that is called the Mentoring Program. Through this project, we support hospitals in the calculation of the climate, of the carbon footprint, and in the creation of a carbon management plan. And all these hospitals together that been doing this project will influence their health system. Yeah, I think I hope that I answer your question.
Thank you. Absolutely. Thank you. Thank you so much. So I think you made a very, you are kind of supporting also what Andra has been saying. Health professionals need to drive change. Yes. That is a key ingredient actually or a key success factor. Networking. So it is a very dynamic field of work with many areas of work mushrooming in different places, so thereby it is very important also to facilitate the exchange and the networking among professionals, and also hearing inspiring examples from other countries. And what I also found important is tools are available. When you speak about your net zero operation projects, there are tools available that actually also provide support and guidance to those who want to become champions in this field, that can be used to start changing the picture. Thank you so much for that. I now turn to Caroline Kostongs. Caroline, thank you for joining. Caroline is the director of EuroHealthNet and also very engaged in the field that we are discussing here today. And I want to ask you on how we, continuing on the theme on the health professionals in a way, and how we can we provide health professionals and also the policymakers actually with the tools and resources they need to drive that transformation, if you wish, staying in the language of this conference, to drive the transformation that we would like to see towards greener health systems, climate resilient health systems in the health sector and beyond. Over to you.
Yes, thanks a lot for the question, and it's a pleasure to be here indeed. Transformation is the big topic of this conference, and indeed we need to transform our health systems because they are currently not sustainable at all. And we need to also see what is then our vision for the future for our health systems. And I think we need to build this vision together with health professionals, not only the doctors and the nurses, but also the physiotherapists, the nutritionists, and public health workers as well. And we need to debate various elements of this new health systems. And I would like to highlight 3 elements that I think are important to talk about. The first one is that we need to reduce the burden on health systems. We have to boost prevention and health promotion, because by reducing the disease burden, we make less use of health systems and therefore it's more sustainable, no? We can do amazing things with linking public health workers and environmental sustainability workers, because we all want people to be out of the car, to do active travel and using the bike more. We want people to eat more plant-based diets, eat less meat, which is also better for the health. And I think health professionals have a very strong voice here, and they can take their advice to the patients, to the people around them. And already in the field we see very interesting activities emerging on the ground on greener and healthier community projects. A second area of debate is that we see, and we heard it also in the plenary session before, that there is an overconsumption in health systems. You know, health, mainly also due to some of the economic drivers in health systems that leading us to overconsume maybe pills or medical treatment? And is it all needed? And what incentives can we have in the health system that allow doctors and nurses and healthcare professionals to keep people healthy and take them off pills rather than on pills, because we know that pharmaceuticals in particular are very polluting. And health professionals need to be enabled and to be given the space to implement that by themselves in their practices, and they need to be supported very much to do so. The third area where we need discussions is how we can be working more with other sectors. It has been mentioned here as well, taking patients outside of the health system into nature before, for example. We see social prescribing or green prescribing linked to mental health services, linked to social services, and really use the assets in the community to promote health and well-being and also mitigate climate change. What is important is by developing this vision of a new health system, we really need to encourage health professionals to co-create that. We need to develop the strategies from national level to guide what can be done, use very much the bottom-up initiatives and great ideas and work on it together. And at EuroHealthNet, we are developing a thematic working group with our members, which are mostly public health actors, public health institutes, and regional health authorities, to start developing this vision for a greener and more sustainable health system. And we are keen to also contribute and work with WHO and the partnerships that you are launching, because, of course, we all need to do this together. So.
Thank you so much. Yet another speaker highlighting the instrumental role of health professionals in the whole picture. I think that is a recurrent theme in this discussion, that health professionals will need to be equipped with the skills and with the knowledge actually to support and drive this agenda from different perspectives. And last not least, also from the prevention promotion perspective, as we know that several interventions are both, in simple words, good for climate and good for health. So if we invest in active mobility, this is reducing carbon footprint while also being beneficial for health. Investing into healthier diets is good to reduce methane and carbon emissions, but it's also good for better health. So I think having also co-creating these kind of relationships and making the case for those hand in hand will be very powerful, and the health professionals will need to play a very important role with that. Thank you so much for bringing these points forward. Finally, I would like to turn to Francisco Murano. I knew I'm going to struggle with that. I owe you a drink, Francisco, later on. But anyway, Francisco is member of the executive board of the European Junior Doctors Association. Thank you for joining this panel today. And I think in the whole climate debate, intergenerational justice is a big topic, and the call for action on politicians we see on a daily basis on the street, but not only on the street, but it's also kind of transcending into professional networks and associations. So I'm really glad that you are here with us. And I'm sure that this topic that we are discussing today is also a hot topic among young professionals. And I would like to invite you to share your experiences a little bit on, to share with us on in how far the aspects on environmental sustainability, on climate resilience are actually part of your activities, of your discussions, and what actions can be done from your point of view by different stakeholders to move onwards in this agenda, and how you would see your role as young professionals in that. These were 3 or 4 questions at the same time, but I'm sure you will cope. Over to you.
Thank you, Oliver. Thank you so much. And I know the name is difficult, but you did great. And I'd like to start to say good afternoon to everyone and to thank you for the invitation to be in this panel today. Much has been said, and being the last one of the panel, maybe I don't have much to say, but I hope I have something more. And regarding your first question on how far are junior doctors and young professionals involved in this topic, I would say that the interest and involvement is much more on the general topic itself and from a general and personal interest than much more of the specific topic of this problem in the healthcare sector. Because there is a very big lack of information amongst professionals, and among the doctors is the same problem. It's not a question of generations, I must say. They are probably more aware because the issue is more trendy and people is more aware in general, but especially and specifically on the healthcare sector, I think people is still not aware, and they don't have awareness of the impact of the healthcare operations on all the climate problem. And just as an example, a recent survey in the United Kingdom in medical students showed that despite more than 90% of the medical students thought this was an important topic, less than 2% have been trained on it, and less than 3% felt they would be confident to answer a question regarding the topic. So there's still much work to be done on this topic. This is not a topic that has been taught in medical schools for a long time. It's starting now, and in some undergraduate curricula it's been a topic, especially in the UK, for example. But in postgraduate training, at least in medical profession, it's not a topic usually, except for some specific areas where there are some specific hazards, chemical or biological, like radiology, where they get trained on it. But in general, there's no training on this topic on the curricula. So there is room to have some action. And I think that's obviously what we have to call for. Not only call for the governments and politicians to do it, but also for us to have an active role on it. It's not just calling for it, but also participating on it. And the first thing that I'll say that would be an interesting action on this would be to include this in the training programs, either in the undergraduate or postgraduate training, and especially in Europe. We have some European terms of reference for medical training where this could be included as a topic. We know that this is a lengthy process. Whatever happens in the academia takes a long time, and in the meanwhile, some initiatives can be taken. And there are some initiatives already in place, and I can also brought some examples. We can include junior doctors in the design of clinical pathways, for instance, and with the assistance of sustainability leads, design the clinical pathways in a way that sustainability is also included and taken care of. Another example of initiatives that are already taking place is in some countries we have some quality improvement initiatives, which are part of the portfolio of the junior doctors that have to perform it during their training. And obviously, if they get the assistance of someone from the sustainability area and from the operations area, they can do some improvement initiatives regarding sustainability. And this has been taking place, for instance, in some European countries. And obviously, we have to promote and reward research on this topic and research on the ground. So there is need to be funding on that. And that's one of our call for actions. And in the end, one of the topics that I think that could be important and an important initiative is having sustainability stewardship in institutions like we had for the antimicrobials and antimicrobial resistance. We implemented programs very successfully in many institutions regarding the stewardship on this topic. So we can implement the sustainability stewardship programs in many institutions, and I think this could be a great opportunity to further develop on this area. And if we can integrate the junior generation on this stewardship, I think we can further develop. I think there's an intergenerational topic on this, but for sure everyone needs to be involved, and if we can involve everyone, we can get a better result for sure.
Thank you so much for sharing these thoughts. So what I take away is, surprisingly, there's not much in the curricula at the moment in the medical education, which, I mean, surprising in a way, as this is not a new topic of discussion that we are having here, and to hear from you that this is still kind of the educational system is still lacking behind and not addressing this in the education is something probably that we need to push the button collectively to get strong into this field. And I love the idea on the sustainability stewardship. I think this is a great idea that we can probably also use and bring forward in our feedback to the outcome document of this meeting. Thank you so much, Francisco. I would like now to turn to the audience, even though I can hardly see you, because these spotlights are very hard on I forgot to bring my sunglasses. But I would like to invite the audience to share reflections, or if you have also specific questions to the panelists, this is the time now for you to come in. And I see already a hand. Thank you for saving my saving the silence in the room. You have all yours.
Diederik Arendt, European Forum for Primary Care. A specific question to Gabriella. Is there an argument to start with only the hospitals, or is that just a choice and then thinking about the rest of the system? And if you are interested, we are interested to work together to engage also with the primary care professionals specifically.
So the reason why we work with hospitals, I mean, Healthcare Without Harm globally is like 30 years old organization, and in Europe is 20 years old. We don't work only with hospitals. Our main network is our hospitals, and are usually the things happen that there is one healthcare professional, someone in the management that decide, okay, we want to go sustainable. So we don't only work with hospitals, but it's our backbone, or it's the backbone of our organization. We work with hospitals, with single healthcare professionals, with other organizations. We try to create partnership with everyone, because we know that to achieve something big, we have to work all together. But working on single hospitals is obviously easier than trying to work with one health system altogether. And obviously there are members of our hospital that are health system. So it's a mix, but mainly with hospitals.
It's the invitation. We had in Dublin on the European Public Health Conference, we had already a start with sustainability in primary care. So there is a group, and we would like to engage.
This is great to hear that the momentum is being created in this meeting also. With new players coming to the picture and joining the agenda. This is very nice to hear. Are there further observations, comments? Please here. Oh wow, 3 hands. All four. All in the same corner. So first,
the activist corner. I'm Mark Pearson, OECD. I'm very interested the figure that you came up with right at the beginning when you said 70% of the carbon emissions from the health sector are from the supply chain. And I was wondering if anybody had any ideas on how to do anything about that 70%, as opposed to what's happening, at the actual healthcare delivery end.
Think that,
Gabriel, you want to go with that?
Yeah. The 70% is the scope 3 emission that are all the... Sorry, Dora.
First, Gabriel, and then Dorot.
I cannot see like that side. Are all the indirect emission of the hospital. So the first two, they are really small because they contain not so many elements, but the scope 3 is huge. It contains so many things that obviously are related to the supply chain as well. That obviously also, like by number, by how much is the extent that part is kind of obvious. There is such a big, and also because, as we said, even when hospitals is sustainable, sometimes cannot become 100% sustainable because there are some things that are not fully dependent on the hospital, and those are really hard to change because there are so many things that have to be taken into account that, Dorota, you can complete my answer.
Origins of this 70%, but I think that in qualitative terms, the message is that there is a huge potential in all these elements of supply chain for intervention and for reducing. And then these things will look differently. People can make certain choices depending on the analysis of a certain particular situation, but there is a whole spectrum of actions that can be taken to contribute to reducing this component, so this proportion of operations of the healthcare facility, like hospital, and these second and third layers. Thank you.
I may chip in that the Dorota has been speaking earlier about this emerging partnership on health sector climate action, where exactly these things also will be further unpacked in a sense of what actions you can actually take to reduce the individual footprint that a facility may have, or the health sector at a national scale may have, and also to invest into the pragmatic actions that you can take. And there are also alliances currently being formed, for example, towards a joint initiative for greener procurement, for example. So because one single health sector may not have the purchase power to do that, to work with the manufacturers to reduce the footprint, but if an alliance of countries is coming together, then probably the power is strong enough also to look into, together with the manufacturers, into how the footprint can be reduced, both in the production side, but also when it comes to transport, for example. So there are ongoing initiatives emerging as we speak at the moment.
Oliver, if I could add,
Sure.
it's just to say also that there is this continuum from individual healthcare facility through, for example, regions. You mentioned about creating alliances for procurement. It can be a group of countries, but it can be a group of healthcare facilities within the region. And there are also discussions, I don't know, Bettina, whether you would be mentioning the Regions for Health Network, for example, where the discussions is. So it's I think the message really to get across is that there are many dimensions from, actions at healthcare facility to supply chain, individual healthcare facility up to the national and international level, where we really can make a change. Thank you.
I need to put my hand just above my eyes to see who is. You are next.
Hi, I'm George Valiotis. I'm from the European Health Management Association. Thanks to the panel for your great diversity of experiences. I have two comments. The very short one is, I think we need to be very careful in our response to the environment to not exacerbate inequalities, especially when we're asking people to change how they get to work. If people aren't physically able to, then that also creates some challenges in terms of inequalities. So can I ask that we have a consciousness of people's physical abilities, of whether they can physically ride a bicycle to work, is one comment. The other one is, at the European Health Management Association, we are coordinating something called the Be Well project. This is for the EU member states. And so we're building a movement of how to better address the ecological footprint. But there's a lot of public things that are available to everybody. And so we have a skills monitor as part of that, where we're collecting all the different trainings that exist. These are competency-based trainings, formal qualifications. They are on the Be Well website. And I'm mentioning this as a comment to say also, it's open to people submitting any comments that they have. So if you have courses you want to see there in any language, for any skill level, for any, whether it be for physiotherapists, for doctors, nurses, anybody. So we've got a skills monitor there, and we're working with Caroline Costongs and her team at EuroHealthNet, who are doing our theory of change on that. So that's a big opportunity there as well.
Thank you so much for reiterating or emphasizing the equality dimension of the actions being taken. I think there's no opposition in this room that this dimension will need to be watched very carefully. Also, thank you for sharing the resource hub that you are having, and then where materials are available. I think it's you, Bettina?
Yes.
Yes, okay.
Okay, it's very difficult. So first of all, Dorota, Oliver, Rob, etc., super thanks for moving this ahead, right? So, I'm an old colleague of Oliver, started in 1997 to set up the first climate change and health program in the WHO regional office for Europe. So therefore, my question is the following. What I am saying is, I'm seeing more of everybody of us, more of the health community being engaged. But what I'm not seeing, and that is the results of today's discussion at the conference of the parties, that still, even though, I don't know how many ministers were there, but at the end, 60, 70, something like this, traveled over to COP28, and this is, at least from what I know, at least the 20th COP WHO is participating to, right? The essence of it, of the reduction of the greenhouse gas we require, is not there, okay? or to the level it would be required to keep it to the 1.5 degree of our world. So therefore my question to you, being in this meeting, the transformation required, considering the world development and where we are with the decisions we are having with regard to our planet, okay, how much is the real change we can actually do in our own work? And I hear the national adaptation strategies, I hear the NDCs, I hear the medical training. How far can we be? Where can we be in 2030 if we put all of our efforts, financing, equity dimension, you mentioned it already, into one pot? Question. Sorry, it's a bit of cynical, and I know it's not so positive at the end of the day, and I'm doing myself in the Regions for Health Network with the small countries. I mean, we are all trying to go on and on and on in the Intergovernmental Panel of Climate Change to get the science right, etc., etc., etc. But I have this little bit of, if we all put ourselves together, where can we be?
Thank you. Thank you. This is a rough one, Bettina. I think you just opened the topic for our next full-day seminar on that. I'm not sure that the panel here today will be in a position to give you a satisfying answer, but I see that Breda has a proposal.
No, well, I definitely haven't got your answer, but what I would say is that ultimately, I think to achieve any goal, it takes leadership from the top down and the bottom up. And it's, you know, all these strategies and plans are only one part of it, but it's the translation into actions. And for ultimately what we're talking about here is behavior change in many ways. And it's like what we were requiring during the pandemic, but we need it now on the climate agenda. And that requires the behavioural and cultural insights with regards to why people aren't engaging in it and what we can do to actually get them to engage in it. And so, and when I say leadership, I think it's in every sector, like our healthcare workers, you know, and in our schools. It is, and it's going back to that, I think it's going back to the whole argument of prevention again. And I was listening to the conversation upstairs about investing in our healthcare. But it is really about, you know, that primary and preliminary education with regards to health literacy and literacy with regards to climate and its effects and how we can prevent it. And I think ultimately there is no clear answer. We all wanted the net zero, but we have to strive towards it, but it will only take a solidarity and a social cohesion to actually achieve that. And I think it's those principles that could maybe help us along the way.
Thank you so much, Breda, for rescuing the panel of Bettina's question. I saw one more hand. Dirk, over to you.
Where's
the microphone?
Right there.
Yeah. We need to, I'm under time pressure now. We need to make it short.
I'm going to keep it brief because the elephant in the room was already mentioned, I think. Thank you for that. I think it's not being optimistic or pessimistic, it's about being realistic. We're heading towards 2.5, 3 degrees at least. So that means that as a healthcare sector, we'll be undergoing what will happen. Floodings, dengue, malaria, and so on. The most of you have read the Lancet review recently. And also, it was something that we discussed. It was a wonderful meeting organized by WHO Europe during the COP28. I think everybody is aware that we should start preparing. COVID-19 showed that we do have a lot of resilience in our healthcare systems, but that was a one-time event. I think it's clear that we'll be facing repetitively that type of events. So it's a good suggestion. Let's have a separate event in the near future because this will have a profound effect of the rest of our healthcare system. Resources are limited, healthcare workforce is limited. So I think that next couple of years we will have to make choices we probably don't want to make. And again, I'm not being pessimistic, but I think we should be prepared more than we are now to face that, and especially towards our citizens and public health, they will be facing a lot of challenges. Just think about the floodings we're all already seeing. Thank you.
Thank you very much for, putting it very much on the scale of urgency of this action that is required. And just as a personal note, I'm really delighted that we have the opportunity to have this discussion as part of this very conference, because that discussion didn't take place in the Tallinn context 15 years back, nor on the birthday parties that were in between, but it is now the first time that we were able actually to bring this to the agenda of the health systems. And I would say we have come to stay with this discussion, and it needs to be woven in very tightly into that health systems debate, particularly when we speak resilience and sustainability and the future of health systems. Can I ask the audience for 3 minutes, 4 minutes more patience, and then, yeah, I see a little bit hesitation, but I do it anyway, because I want to invite each and every panelist for a 30 seconds takeaway message that Nicole can type in her minutes of the meeting and that we can pass on to the Masters of Ceremony of the Tallinn conference. I would really like to harvest one punchy takeaway message from all of you. And I start in reverse order. Dorota, sorry for putting you on the spot first.
To be very brief, I would say it's empowering the people. I mean, it's empowering healthcare professionals through training, but also through giving them tools to really take action, so that they are not left with the information, but that they are prepared for acute emergencies, but also for these longer-term challenges. And this is also an instrument to build trust within health professionals and to the communities. Thank you.
Superb. Empowering health professionals. Francisco.
So I'd say just in 4 points: raise specific awareness for the topic, invest, educate, but also involve people by giving them tools. And this can be achieved, and as a suggestion, by the implementation of the sustainability stewardship programs, for instance, is one of the tools where we can congregate these 4 dimensions that I've talked about.
Sustainable stewardship. Caroline.
Yes, I think we have to put this in the wider concept of achieving a well-being economy. So economy that serves people and that serves the planet. And we have to take that model and apply it in the health system. So achieve health systems that serve people and serve the planet. And in that exercise, we shouldn't forget to boost the change in people's behaviors towards more environmental friendly and sustainable behaviors and healthy behaviors, because it's often go together with inequalities very much, of course, at the heart of it.
Well-being economy. Gabriela.
See, I would say just that we more or less we know the goal that we want to achieve, but sometimes we don't know how to achieve it. And I think the only solution that we have to find a way to arrive where we want is to work together. It's also the fastest way, and to have the possibility also, like today, to have this kind of space to share and our experiences, and it's also a way to support each other work.
Working together, and I add personally across sectors.
Yes.
Andra.
I will continue the same message, working together, but maybe on a local level. If we want to make transformation happen, then we have to co-design it, because otherwise we'll make it up to down, and then there are disputes and confirmation. We have to do it all together.
Emphasis on local level action. Rita, I understand it's getting incrementally more difficult.
Yes, there was.
So you started with you have another.
So I suppose I will go back to what I previously said, and I think it will require what the panelists have also been saying: leadership from the top down and the bottom up, empowering people through behavioural and cultural insights, and enabling compliance with our efforts with regards to achieving our goals.
Yeah. So bottom up, the top down need to meet productively
in order to achieve anything.
To achieve anything. Thank you so much. I would like to invite you to join me to give our panelists a big hand for This has been a very inspiring discussion, even though 60 minutes I felt was far too short to even start unpacking that complex agenda. And I hear you, or we hear you, that we need more of these conversations, and we will continue on that bandwidth. Please stay tuned. And I will not add yet another summary, but I think we have heard a few clear messages that we would like to bring forward also to the masterminds of this conference. And I think we need to collectively work in making sure that, first of all, climate resilience, low carbon, environmental sustainable become integral ingredients of the discussion of health systems. And I think we need to nurture that in the years and decades to come so that this becomes an integral component of our collective efforts. With that, I would like to close that panel, and I wish you a lovely remaining part of the conference. Thank you.